We drink coffee a lot, or we know someone who drinks a lot of coffee. And I'm sure we see a lot of coffee cups, or any used cups for that matter, that are disposed of irresponsibly. Sometimes used cups are left in the public, such or left on stairs, such as the one you see in the photo. Correcting the behavior of a responsible throwing of coffee cups is something that we can do in social and behavior change communication. Juhaira has shared in the previous module about SBCC, but in this presentation, we're going to extend the discussion on SBCC, specifically on its nature, characteristics, and the socio-ecological model as a framework for social mobilization. SBCC is the systematic use of interactive, theory-based, and research-driven communication processes and strategies to address change at the individual, community, and structural levels. It is systematic because it is planned, organized, and well thought. It is interactive because the strategies are complementing each other. They're dynamic, efficient, and promotes two-way feedback mechanisms. It is theory-based because it follows a certain framework, in this case, the SEM. And it is research-driven because it is based on facts and data and not on feelings alone. SBCs or SBCCs are strategic, systematic, and targeted communication. So we are able to influence what people know or their knowledge, what they feel or their attitudes, or what they do, what they practice. SBCC may come in the form of a mass media campaign that promotes condom use to prevent STDs such as HIV through public service announcements and or serial dramas on radio or television. A theater group performing a play about gender-based violence for a community and holding a discussion about it afterwards is also an SBCC activity. A radio talk show that answers listeners' questions about family planning or teenage pregnancy is a form of SBCC. A school-based program that encourages students to delay sexual debut, and a short message service, SMS or texting, or even a hotline service to provide information during an outbreak, such as what happened in COVID-19, are also forms of SBCC. SBCC has evolved from the information, education, and communication movement that basically had a lot of sporadic awareness campaigns. Then it transitioned to health communication, where studies are used or where studies and practices are used to communicate health-related information to specific audiences. At the very core of SBCC is BCC, or Behavior Change Communication, where the emphasis is to analyze behavior and determinants to affect or induce change in, again, knowledge, attitudes, and practices. The focus of SBCC in this progression is to use a more comprehensive approach that would include the personal, cultural, social, economic, and even political layers or profiles of a particular audience or a particular group. Important to note that SBCC includes changes in two major areas. One is the social change that we need or we want to see in social orders and institutions, in social behavior, or in social norms. The other type is the behavior that we want to see in ourselves as humans, or the changes in our human behavior. Change, again, is something that we want to make or we want to become different from what they are now. Hopefully, we want change for the better. Behavior is the way a person acts or reacts, and norms are accepted standards or ways of being or ways of doing things. There are three characteristics of SBCC, and it's characterized by its process, by the model it follows, and three key strategies that it operates within. Number one, SBCC is a process. We know that from the particular or from the previous module that it follows a certain procedures from identifying the situation to analyzing the communication or the communication inventory to focusing to a particular communication strategy to actually creating intervention and materials that we want to effect change, to implement and monitor those materials and the change process itself, and finally to evaluate and determine if there's a need to replan or calibrate our program for outcome and sustainability purposes. We have learned previously from the other presentations that we can use the C planning or the P planning models for SBCC. SBCC requires a socio-ecological model, or we refer to it as SEM. It examines several layers of influence to provide greater insight for communicators into the causes or roots of problems. It means that we ask ourselves, what are things or who are the people or even institutions that surround and can influence the target audience or can influence the formation of a problem? SEM is based on the theories and tenets of psychology, human behavior, and is centered on the self, the individual, and all the people or information, institutions, products, services, and the enabling environment that circles it or that circle it. This means that all these rings outside the self can contribute to the formation of a problem, or even the self can contribute to the formation of a particular issue or problem. The SEM reiterates that there are cross-cutting factors in this slide that you see that include messages or information, basically the people's knowledge, the motivation, or do they have the correct attitude and belief to act, their ability to act, their skills, and their access to resources in order to perform such act, and the norms that can mediate their capacity to believe, to follow, to adapt, and sustain behavior. What you see on the screen is a variation of the SEM model as used by the United States CDC. If you look closely, it still considers the complex interplay of the individual, his relationships, community, and societal factors. Still allows us to understand that there's a range of factors involved that can put people at risk for the formation or the development of a particular problem or issue. We also see in this particular variation that the overlapping rings would indicate that one factor can influence another factor at another level. We have to note that in this particular variation or flexibility of the SEM, the individual or the self is no longer the center of the SEM model. Lastly, SBCC operates through three key strategies, which are advocacy, or anything that is geared towards convincing political or social leaders to design and implement policies. Social mobilization, where we gather stakeholders to participate in the programs, where we get all possible contributors and units together, whether these are human or non-human resources. And of course, behavior change communication, which involves the individual and the community, multimedia, and other participatory approaches. In the BCC circle, we have to remind ourselves that we're not targeting the entire population, but we're looking at a particular segment of a particular population to change what they know, what they feel, how they feel, and eventually how they act on a particular problem or issue. Professor Bandalaria reiterates that advocacy works primarily to change the behavior of public leaders or decision makers, ultimately favorable to the advocacy that we want to push. Communication generally targets individuals and small groups on the other hand, and social mobilization aims to secure community-based support. That's it for SBCC and the SEM model. These are two questions for our discussion points. And these are the references I use for this particular presentation. Thank you very much for your time and have a good day wherever you are.